Next, we have TIMA team. Let's talk about the now we have Dr. Chen Ruiguang, who is going to talk about how to prevent common infections in the elderly. Why is he in the USA? So, when going back to Taiwan in Kaohsiung, so basically where I work should be where I practice my religion. So if I can do in daily life and give back to the society is important. So this is from Kaohsiung Ceci International Medical Association member. Hello everybody, we are very grateful to be here. Basically, there are a lot of diseases that impact the elderly. So there are, whether you get a flu, pneumonia, all happens in the cold season. So why do people get sick? So traditional Chinese medicine says that's due to imbalance of qi and the blood and leading to decreased immunity. Of course, the internal cause could be due to stress, leading to changes in mood. For example, your joyful feeling, your anguish, your sorrow, your fear, your shock, all these can lead to stresses. Of course, external factors such as diseases, wind, cold, summer, dampness, dryness, and so on. And all these environmental factors can also cause uh, you to be stressed. Of course, there are also internal and external causes as well. So these internal or external causes may be because of our living habits. So this could be due to fatigue. It can be the wrong diet, could be insufficient exercise. Uh, of course, if you have traumatic injury to your body, then happen as well. The Western medicine causes structural dysfunction as well. This will lead to decreased immunity. So genetic factors could be leading to congenital diseases. It could be uh, immune diseases, met, uh, metabolic diseases, or cancer. So internal causes are many. It could be mood swings. It could be diet. It could be work and rest that is not sufficient. So the external causes can lead to microbial infection, and this will lead to infection. So what are the common infection prevention measures we can adopt? Immunity enhancement is one way. In Western medicine, we are talking about, of course, individual vaccines. For example, vaccine against influenza, against the new coronavirus. or against streptococcal pneumonia, against herpes zoster, or against cellulitis. For example, antibiotic prophylaxis. So TCM will believe more in holistic immunity. For example, we adjust according to the syndrome, prevent disease before the diseases happen. So have a moderate diet is important, a regular daily life and regular exercise. And we must adopt physical barriers. For example, we have to remember to pass urine and we must remember to cover our nose and mouth. So the flu vaccine starts maybe October. Uh, so, so if you are elderly over 65 years of age, or if your parents living in long-term care, such as nursing home, then you must remember that you need the flu vaccine every October. So you must also understand that especially pregnant women may suffer from cardiopulmonary disease, so you must have preventive measures. Of course, you are targeting diabetes, renal insufficiency, and so on. Actually, we must emphasize more on focal pneumonia vaccine. Uh, Streptococcal pneumonia, which is latent in the human nasal cavity, can invade the respiratory tract or blood through droplet transmission, causing pneumonia, bacteremia, meningitis, and other serious diseases. So all these vaccines are very important. So there are the 13 valent or 15 valent conjugate streptococcal pneumonia vaccine that can be adopted. The government has also come out with different vaccinations. For example, the regime may be doing the 13 or 15 PCV vaccine, and then later, 1 year later, maybe you can consider taking the PPV 23 vaccine. No matter what, if you are above 65 years age, it's very important for you to be able to be vaccinated. So these are provided free by the government. So you go for it. Next, we talk about herpes zoster. The herpes zoster is can be very debilitating. It's the most this post-herpetic neuralgia is the most common complication of herpes zoster, with incidence and duration increasing with age. So it could come up to 3 months or up to 1 year, the pain symptom. So it's important to be vaccinated. So for herpes zoster vaccine, you can take the Sostavax or you can take Shingrix. So the Sostavax was active in the 20s. Now, since 2017, we are able to take the vaccine from 50 years onwards. So the first dose may be taken now, and then the second dose can be taken 2 to 6 months later. Then the another condition we talk about is cellulitis. For cellulitis, we will then it's very important to talk about what are the risk factors. So all these risk factors tell us that we must do local as well as systemic prevention. Because what is not correctable may be the surgical scar that results, or we may end up having artificial joint installed because we cannot take care of the cellulitis in time. So sometimes we can do one injection every month. To, to sum up, so the occurrence in disease has internal and external causes. So traditional medicine and Western medicine will do same process. So remember that if you do vaccine, it starts in October every year. Those who with risk factor must take the pneumococcal pneumonia vaccine. You first take the conjugate type 13, 15, then you can take the PVC 23. So I really thank you for listening to us. Thank you for listening. Really thankful for TIMA team. So we'll pass over to you, Sister Ati. And then Sister Effie will pass to you. Thank you, Kanan.
And Brother Eugene. Now we'll come to the next segment. So time passes so fast, so swiftly. We are not aware, with this wonderful sharing. Time passes so fast that we are unknowingly, we have come to the next segment from the activity team, relaxing our body muscles.